I do want to say one thing about end of life. A week ago today, I visited a dear friend, mentor, hell of a good woman, author of a book on women's health across the lifespan. And while I was sitting here, I got a text that she passed. So I would like to dedicate my conference to her today. Angela San Marco. Run with the angels, baby. So here we go. Shared decision making. Have any of you heard of shared decision making? Okay, good, then I have something to teach you. I hadn't before I did my dissertation, but I'm glad I ran into it. So here is my hello to everyone. Everyone that can possibly say hello in, I hope. And we as nurses have a common goal for excellence in patient, family, community care, global health through evidence-based practice within the context of culturally competent care. And shared decision-making will assist us with that, although it does need to be modified for different populations. My objectives today are to define decisional conflict, identify characteristics and related factors, introduce the decisional conflict scale, define shared decision-making, introduce the decision support framework, and explain the role of patient decision aids. So what is decisional conflict? We as nurses are very lucky to have our own nursing diagnosis about decisional conflict. And it's an uncertainty about a course of action to be taken when the choice among competing actions involve risk, loss, or challenge to values and belief. And the risk to values and beliefs is where the rubber hits the road on this. And here's a page from NANDA. And I'm sure you've all had patients who had trouble making decisions, had physical signs of distress. They were restless, rapid heart rate. They were questioning the moral principle of the decision that they were making. They're questioning their own values and were very focused on themselves, were uncertain, and were vacillating between choices. So decisional conflict is quite common in practice. Related factors are strongly rooted in the patient's value system. And conflicting, where we come in, it's with the conflicting information that the patients receive. Patients today are in a situation where they're bombarded with information. So we have many patients who come in who can recite the internet to us, and we have patients who are being, I would say, influenced by their family members in what decisions to make. Maybe they have religious reasons that they're being pressured to make a decision. So these people are, in fact, in decisional conflict. Decisional conflict can be measured. I was very fortunate to work with Dr. Annette O'Connor, who in 1995 and then revised in 2005 the Decisional Conflict Scale. And the Decisional Conflict Scale looks at patients' decisional conflict based on screening options. So it measures their perceptions of their uncertainty, what factors in their lives can be modified that are causing the uncertainty. For instance, if they feel uninformed, we would play a big role in that. If they're unclear about their personal values, using the Decisional Conflict Scale, we can help to clarify their personal values. Or if they feel supported or unsupported by their significant others, that can be identified using the Decisional Conflict Scale. And then it addresses effective decision making. And in one of its subscales looks at the patient feels informed, feels that they've made a decision that's consistent with their own personal values, and that these decisions are likely to be implemented. People who score high on this particular area of the Decisional Conflict Scale are less likely to have decision regret afterwards and are less likely to change their mind during the course of the decision making. So it's a nice scale. There's several versions. It's been around for a long time. Validated in several languages, translated to several languages. I'm addressing 4 formats here. There's the traditional question format, which is the format that I used in my study. 5 response categories along the Likert type scale. It's available in English, French, Danish, Chinese, Spanish, German, Japanese, Italian, and I hope Thai soon. It's a 16-item scale. Takes about 20 minutes to complete, so it's not a really cumbersome instrument, and there's 5 subscales. And it's just a yes or no answer at the beginning, and then answers along the subscales, so, from strongly disagree to strongly agree. There's the low literacy version, which has 10 questions. So this one is more of a yes or no. And it only has 4 of the 5 subscales, and this particular version is available in English, Spanish, Chilean version, and Spanish US